Good afternoon. Thank you for tuning in today. My name is Jeff McKay with Brightsquid. Joining me today is Mark Eyre, Director of Customer Operations.
Hi, good afternoon, everybody.
There he is. We're going to go through a few things today, but we want to talk about a specific workflow. And so this virtual care series is going to take a bit of a turn and just focus on a specific workflow that you can do with SecureMail. And these are the kinds of things that you can educate your patients about. We actually do run webinars for patients, showing them the different use cases, different workflows, and how they work, how they can get engaged more with your clinic through SecureMail. So it's helpful to have that coming from both sides. So let's look and see, like, how do we use SecureMail? There are a lot of different things that you can do. And there's information coming from the CMA, the Canadian Medical Association, the American Medical Association, and different provincial and state associations and colleges, helping your clinic get the most out of virtual care. There is no doubt that virtual care is here to stay. And clinics that might say things like, "Oh, we're just going to use phone and in-person visits." There's much better ways to do it. And SecureMail is a big help in getting your virtual care done right. So you can use it for mental health check-ins. Hey, how's it going? It's totally appropriate for that. There are many conditions can be treated, assessed, and monitored by home devices. You've got chronic care patients who might, have blood sugar monitors or blood pressure monitors, that sort of thing. They can share the data with you through SecureMail, and you can assess it, understand if there's any changes needed to their plan. Urinary tract infections, any kind of minor infections like that can be assessed and treated using SecureMail, video, phone. So virtual care is certainly appropriate for anything like that. SecureMail is super helpful because it doesn't require the alignment of schedules. So trying to get your clinician and your patient lined up at the same time, have the patient actually answer the call, or have the patient maybe download the software if that's necessary, if that's something you're looking at with video, that sort of thing. SecureMail gets around that by giving people the information they need outside of a one-to-one face-to-face connection. So things like sending a lost lab rec, providing advice to patients with complex chronic diseases. So any kind of follow-up, nowadays with COVID-19, a lot of chronic care patients have questions about their vulnerability, any changes they should be making to their lifestyle or their medication or their habits or their plan, that sort of thing. And SecureMail is a great way to have those encounters. Written instructions after an appointment. Patients forget 30 to 80%, depending on which study you read and who the patient is and what the scenario is, of what they're told in an appointment. So you want to make sure that patients have what they need. When we ask our patients, 40 to 50% of them say they don't have everything they need when they leave an appointment. That's a big gap that can be filled with SecureMail. Sending lab results with a revised dosage. So instead of bringing a patient in for a lab results review, you can do that over SecureMail. It saves them an hour and a half out of their day and saves you a couple minutes as well as the appointment time that could be better used for somebody that really needs to get in there and be seen face-to-face and their hands-on sort of assessment. Sharing patient records with other members of the patient's healthcare team. So if you're referring to a specialist, SecureMail is the way to do that. Some clinics do decide to copy the patient on there as well, which helps the specialist on their end get the information they need more directly before providing any advice or booking an appointment. They can connect with the patient and ask them questions. A lot of clinics do that. We've seen clinics reduce wait times by 95% when they do. Treating minor skin infections. So SecureMail is great for dermatology. Anytime a patient has something that's visual like that, they can take a picture and send it in and say, "Hey, what do you think about this?" Some conditions like that can be treated appropriately just by looking at a photo. Some need to be seen, and that's a clinical call that SecureMail can assist with.
So, hey, Jeff, sorry to interrupt here, Jeff, but just one more thing that I'll add in there before we move on to the next slide is if you are using virtual care to assist your patients through the phone or through a video chat, I would bet you that 99 times out of 100, at the end of that phone call, there's a document to be transmitted, whether it's a prescription or a prescription update, or even just instructions on how to, stretch the tension out of your neck and shoulders. And those kinds of documents, that's what SecureMail is built for, is for transmitting that information. So it's not either or, it's a bit of, you have to have all the channels available to properly communicate with your patients.
That's a great point, Mark. And actually, to that, what we see when we look at the number of messages sent compared to the number of attachments sent, it's about 2 to 1. So on average, every message has about 2 attachments. So attachments in sending documents, like you said, is one of the biggest use cases for secure mail, getting information shared, not just in the message that's being typed out, but in some documents that people need to review or get access to as well. So I'm going to quickly go through this mental health check-in with remote patients. Mental health, obviously a large concern today. People are very unsure of what's happening and either need to have some additional contact or access to their clinic, or can't come in and need something that's remote or virtual instead of a physical encounter. So, in this sense, if you have a number of patients you want to do a check-in with because you have concerns about them based on their history, the MOA can send an inquiry message to the patient, say, hey, it's ABC clinic. We just wanted to check in and see how you're doing. Maybe attach a questionnaire, and then the patient can respond to that if they fill out the questionnaire and respond. And then you have a mental health practitioner or a family practitioner who can look at that and assess the condition, make some decisions if anything needs to happen, if they need to be seen, if they should have further contact, or if it's just, hey, everything's great, you might want to note that on the file too, just to show that you had that check-in. So it's a really easy way to have a back and forth. And Mark, as you pointed out, this is really an entryway to any virtual care system or any virtual care situation. You can use secure mail to facilitate the contact in a really efficient and effective way, and then make the decision if it needs to be escalated to something like video or phone or in-person visits. And that's really just kind of the simple aspect of it. I want to take things over, Mark, to you now for the demonstration, just to show some of the components and features of secure mail that enable that. So if you want to go ahead and take over, I'll sit back and let you drive.
Right. So, I've just switched the screen broadcast over. Everyone should be able to see my screen now. And there's a couple of tips and tricks that I wanted to share with everyone that, most people on this call probably already are familiar with sending messages and attaching files and so on. But a couple of important things I wanted to point out. First off, when I'm composing a message, which I'll do now, this is, of course, the process that I would use to invite a patient. And this is by inviting, I'm really saying is that I'm adding someone into Brightsquid Secure Mail and providing them with an account, typically a patient. And I normally do that by just typing in their email address. So I start typing in, test user, and you can see that I've done this before with this made up email address, but I'll just add some random numbers to mix that up. And so when I invite a patient, I enter their email address. When no match is found in my recent contacts or the greater Brightsquid community, I'm presented with this option to invite this patient to create their own secure mail account. Many of you may not know, this is not the only way to invite patients. In this example, I'm manually typing in someone's email address and I'm inviting this test user individual. You should also be aware that you can take a list of your patients from your EMR or your practice management system or whatever that is and automatically upload that into Brightsquid Secure Mail. So if you have 1,000 or 2,000 patients, rather than typing in 2,000 email addresses, it's much easier and much more efficient to upload all those at once. So that's the first thing that I wanted to mention today. Secondly, when you are composing a message, let's go ahead and address this message to our patient and I'll carry on. We'll just make up a birthday form, and there we go. When you are attaching or composing a message, one of the most important components that Jeff mentioned is attaching files. Now, you should know that you can attach just about any file that you can imagine, be they photographs, PDF documents, Excel spreadsheets, PowerPoint presentations, any file that exists on your computer, much like you would email any file that you can imagine. You can also send files through Secure Mail. The above and beyond advantage of Secure Mail over regular email is you can attach really, really big files, as large as 500 megabytes in size. Now, for some context, 500 megabytes is about 10 to 15 times bigger than any common email system would allow you to send. So it's much more information than you would normally send. And when you're attaching files, you can browse on your computer like I've done here, and you can just draw a little lasso like this to drag and drop to select, in this case, 6 different files and attach them all at once. So just a little tip there that makes it a bit easier to add files and send messages to somebody else. Now, I see I don't have very much time here, so I'm just going to show one more, well, kind of two things combined here. I'm going to go back to my shared inbox, and there's a message here from one of my patients. So here in the shared inbox, of course, you can see all the messages that have recently come in, either from patients or other professional users. And in this example, we have a message from Mr. Adam Abel. And you'll notice that when I open this message up, it actually shows that this is a thread of messages. This is an ongoing conversation I've been having with Adam. And by default, the old messages are up here at the top and they're collapsed, but they're also available in the message that Adam just sent to us about a half an hour ago. And I can read from the bottom to the top where Adam says, "Hi, Dr. Fauchard. I was in on Friday, et cetera, et cetera. I need a sick note from my doctor so I can give it to my employer." And then a little while later, Clara writes, "Dear Adam, the note from Dr. Fauchard is attached. Let me show anything else." And then now Adam has replied to Clara saying, "Can you update it to show my work date? Return to work date is July 22nd. So what this is showing is a back and forth conversation, not unlike a chat interaction, where in this case, Clara, the MOA that I'm currently logged in as, and our patient, Adam, are able to have this back and forth conversation almost in real time. But I'm really just trying to demonstrate that this is a threaded message that does have some back and forth. Now, at this point in the conversation, from a clinical point of view, Clara, as the MOA, doesn't have the authority to update the return to work date. That's something only the doctor can do. So now I need to loop in Dr. Fauchard, as he's the one who signed the initial sick note. So let's go ahead and just select forward down here at the bottom of the page, and then I can forward this message, oops, if I spell his name right, to Dr. Pierre Fauchard in this example. So I would just click on this blue button, send him the message. He can update the sick note in the EMR, and then either the doctor himself or Clara can then send the updated sick note back to our patient, Adam. So that's that little tip. I'm going to turn this back over to Jeff because I know we're short on time today, but if there are any questions, you can enter them in the GoToWebinar panel on the right-hand side of your screen, and we'll try to answer as many as we can before we run out of time today. Jeff, are you still there?
I am. Thanks, Mark. Let me grab things back here and just have a few other points to hit before we wrap things up. And so, you know, there's other advantages we can do. So like you talked about mental health, right? This is a great tool for mental health. So patients that had access to the clinic or engaged with their clinic through secure messaging systems had a 50% or greater decrease in their depression measures. So it's a valuable tool for mental health issues that can be employed very easily and quickly, as you just saw, thanks to Mark. Other minor questions and concerns can be addressed through SecureMail. Anything that's not urgent or that requires physical hands-on assessment. And there's lots of discussion nowadays on the internet about what does actually require physical assessment. So I certainly recommend you trying that, checking that out. You also get, like we said, a written record of the conversation. So, you know, if a patient comes back and says, "Well, you told me to take 5 of those pills a day," and then you said, "No, here's the message that says 3, you're being dangerous." You know, patients in the clinic can be well prepared for the next in-person appointment. So we can help make better use of time. Clinics that send out questionnaires before appointments, you know, "Hey, you're coming in for a knee concern. Here's our questions about knee concerns." And even just having the patient think about that in advance is very helpful. Clinics can see more patients while keeping patients and staff safe. So as I've mentioned before, there's an 11% increase, you know, on average for patient encounters per day when secure messaging is employed in a clinic. Additional resources. So things are always changing. We're always adding more information. You can and should, I would say, take our privacy risk assessment through our website, brightsquid.com. It's just 7 quick questions. You answer them, we'll give you a score. So if you just go to our homepage, brightsquid.com, and click that Take My Privacy Breach Risk Assessment, we'll let you know where you're at risk of privacy breach and how we can help you patch up those things. So we make sure that doesn't happen to you. Also, sign up for a regular virtual care webinar. So these webinars, you can sign up for those. But also, you can take SecureMail training. So we run 2 SecureMail training sessions every week, Tuesdays and Thursdays at lunchtime Mountain, just to show you the real features and functionality of SecureMail. that help you set up your virtual front desk and make sure you have a sustainable virtual care system in place. And with that, that brings us to the end. So we do recommend, of course, you get your privacy breach protection system in effect. Make sure you have an active breach management system or privacy management system. And with that, Mark, I'll say goodbye. And if you have any last words, it's all to you.
No, thanks very much, everyone, for attending today. And as always, if you do have any questions or concerns after the call ends, feel free to contact our support team at the website support.brightsquid.com. Have a great day, everybody.